So now you're a dad, and I'm sure you've noticed that kids do have those range of emotions, but they don't always talk about them. What works for you? How do you check in with your own kids?
Well, we first off, we try to talk about it and normalize the conversation the best we can, because certainly with the job that I have and dealing with 19, 20-year-old young men and seeing the challenges that they face with stress and different things and anxiety, but then also taking it back to the home and making sure that you're providing the resources for your family and talking about those types of things. But really, I think when the children feel comfortable talking about, hey, I may need a little bit of help right here, but then also providing, the therapy or the resources or the appointments that they may need to work with people. And we all have mental health, and we're all responsible for our mental health. And so sometimes it's preventative. Sometimes it's, a reaction to something that's gone on in the past. But I think, again, making sure that we have the conversations and talk about it openly is something that's healthy.
Absolutely. It's like your example, right? We go to the doctor once a year for our physical health. It's okay to sometimes need that preventative check-in. Yeah. Absolutely.
And that's really what I try to, as many times as I can talk about it, for our players. So, you roll an ankle, you know what to do. You go to the trainer, you get taped up. And if you don't tape it up, that's going to become a bigger problem down the road. If you tear your ACL, that takes a major surgery. It takes 9 months to recover from. Well, you think about that in the mental health area. Something little can add to a big thing if you don't address it.
Right.
Or if something major happens in your life, that may take something more. It may take medicine. It may take therapy. You don't know what that treatment's going to be, but you know that if it's a major thing, that you're going to have to do something in order to kind of offset that, to build that resiliency. And that's one of the other things that I think is exciting is, as we start to build that mental strength and have these tools and the resiliency to work through these tough times, is really what we're trying to do and make sure that, again, that they have the tools.